So we'll start with a very simple remedy, a small remedy, so that we also get used to it. Fine. See now, this being our first class, every year, whenever we introduce a remedy to you, meaning in first year, second year, third year, final year, it's going to be a little different. Okay. So as a final year student, what is your expectation from the material class? I mean, I hope you understand. See, you evolve as a material student from first year to final year. Okay. So every teacher, they will have their own plan when they teach in first, second, third, and of course the final year. So what is it that you are expecting? What exactly you want, so that we can plan the classes accordingly. So what is it you want? Okay, very good. One thing is, one expectation is comparison. Yes, agreed. Then what else? Other than comparison? Understanding the remedy in depth. Okay, very good. So how deep you want to understand? Okay, we'll come to it. So one point is understanding the remedy in detail. Okay, agreed. Anything else? Okay, the therapeutic part. Yes, it makes sense. The therapeutic part. What else? What else?
Case discussion as an example.
Okay, one of your friend rightly says, we are in final year. Next 6 months we'll be passing final year and we'll be legally ready to prescribe. So probably getting some cases, showing some cases, and understanding a remedy through a case. Yes, good, it makes sense. Any other suggestions, anything else you would like to add? Anything else? Okay, fine. So now, whatever suggestions you are told, we'll keep that in mind, and we'll quickly start with a very small case scenario. So this is a very fresh case. Few days back, probably yesterday they have started taking treatment. Few days back, 3-4 days back, I had a call from a different state. Her dad is having a CA. It was diagnosed in the month of August, somewhere near August, and it is extensively spread. It started in liver, and then the metastasis has gone bad. And the other doctors are telling at this stage we can't do anything. Right? So this is the case I had, and I know the limitation that you are a final year student, but at the same time I am very optimistic. As a final year student, how would you proceed with the given case? Assuming after 6 months, after a year, you have a case like this coming to your clinic. I mean, what is it that you would like to look at?
Cost.
Huh? Cost? Okay, very good. You would like to look at cost? Agreed?
Cancer in family.
Is there a history of cancer in family? Okay, good. Anything else?
How fast did the disease progress?
How fast did the disease progress? The primary lesion they identified in August. Now it is first week of December. So how fast is it? It's very fast. Okay, now it's a good question. It's a good, what is it? It's a good point that she is trying to contribute. When did it start and how is the disease progress? Okay, good. As a final year student, using your medicine knowledge, any other questions that will come up?
Any systemic disorder.
Okay, any other systemic disorder? Okay, good. Is he a diabetic? Is he hypertensive? Is he having cardiac issues? Okay, good. You ask all those. Okay, is he alcoholic? Yes, possible questions. Because we said the liver got primarily affected. Fine. See, not every alcoholic person will have liver problems. Not every person with liver cancer is an alcoholic. We are not debating on that right now. Right? But anyway, it's a good interaction. Anything else you would like to contribute? Huh?
Recent blood transfusion.
What has that got to do with cancer?
Recent blood transfusion, like there is a transmission of the virus that induces cancer.
You agree with that point? Can blood transfusion lead to cancer?
I think the blood transfusion and the issue.
Huh?
Recent blood transfusion.
Okay, now, yeah, see, it's an open class, you are free to share your views, but it needs justification.
Yeah, because if the person is infected with any kind of oncogenic virus and
Okay, are cancer, from your medicine knowledge, is cancer infectious?
no sir, like virus that can induce this cancer.
Okay, fine. So it's got a point. Anyway, we'll look at it if that is a possibility. Anything else that you can think of? Huh? Okay, you would also like to look at this stage, right? So which stage? Now, why this staging is important? Okay, so for example, naturally the patient had a question, sir, what do I expect after your medication? And the relative who had referred this case, she is very optimistic. She is my patient, she is very optimistic. So what is it that you are going to tell the patient? Fine. So if you have to, tell them, you should know all these things. What is the diagnosis? What is the staging? Is it advanced? Is it the initial stage? Is there metastasis? What is the type of cancer? There are few cancers which are very dangerous. There are few cancers which are slow progressive cancer. So all these things you will get from your knowledge of medicine. Okay. So anyway, I have just started some medicine. I am not sharing that case because only yesterday they have started the medication. But for me it looks very bad case because extensive metastasis. Right? The same thing, honestly I have explained the patient. I am going to try. Fine. I don't know the end of it. Fine. For example, are we going to palliate? Are we going to cure? It all depends. And sometimes one medicine may not be sufficient. We may have to keep changing. Okay, so it's a different way of treating. It's a different methodology of treating cancer. I'm not looking at that for a final year student here, but I just wanted to give you this because the remedy that I'm going to discuss today is something related to cancer. Okay. So now the next question that comes up here is, as a final year student, from your syllabus, out of syllabus, whatever, can you quickly recall the remedies indicated for cancer? Huh? Okay, opium, good. Carcinosin, very good. Asterial rubens, Phytolacca, Colostrinum, okay, fine. See, what I've got no issues. You can contribute whatever you want, but you'll have to justify. In the order. You have to justify what you are trying to contribute. Fine. So colostrinum, fine. So where do you think of colostrinum? Mainly CA liver. Okay. You are talking of asterial rubens. Asterial mainly CA breast, CA mammary. Which side? Left side. CA mammary, left side. We'll look at asteria because I will be talking of comparison. Okay. Carcinosin. When do you think of carcinosin? Huh? See, there's a rubric in a repertory. Cancer which recurs after operation. Cancer which recurs after surgery. Single remedy mentioned is carcinosin. At the same time, many senior homeopaths, they say carcinosin should not be given in active cancers. Okay, from their experience they say carcinosin should not be given unless indicated. Should not be given in active cancer states. Okay, fine. So when there is a strong family history of cancer, yeah, it can be constitution, it can be preventive. Okay, good. Carcinosin, asterial rubens, Phytolacca. When Phytolacca? Again, CA breast. Good. Any other remedies? Huh? Creosote. Good. Where creosote? CA stomach. Very good. CA stomach. We'll explore creosote a little later. Okay. Because if you look at the next PPT, I am going in a systematic way. I gave you a case of cancer and I wanted to give me the remedies in general for cancer, and now we are looking at a very specific area, CA stomach. Okay, so what are all the remedies that come to your mind when we look at CA stomach? Final year student. So a sort of creosote, agreed? Arsenic amount, good. Bismuth, yes, absolutely right, bismuth. Any other remedies you can think of? Arsenic, bismuth, phosphorus. And there are n number of remedies if you open your repertory. And repertory is a subject that is parallelly being studied in your final year syllabus. Okay. From acetic acid, you know, you've got so many other remedies. Acetic acid, and then of course you have conium, carbolic acid, bismuth, fine, hydrastis, okay, and then you know, mesothelium, lycopodium, cadmium sulf, calendula. We'll explore all these remedies a little later. You also have a very rare remedy here, ornithogalum ambulatum. This reminds me of my friend who is a very busy practitioner, and he was a master of rare remedies. Master of rare remedies. For example, in class, if a teacher would ask, name the remedies for polyp, we would say arseid, we would say sanguinaria. This guy from behind, he would shout, Picrium marum virum. All, you know, and the girls would all keep looking behind. Who is this guy? And he was a master of Boric's materia medica. So for example, if he was here today and if you would have asked him CS stomach, he would have shouted ornithogalum ambulatum. You are talking of arsenic, you are talking of phosphorus. So these are few remedies. Keep these things in your mind. We will be looking at this after some time. Okay. So in today's class, I will be discussing something very important, something very interesting. And this being a small remedy, I was referring a lot of source books. And one statement, you know, that I was pretty impressed when I was reading Dr. Clark's Materia Medica. He says, in this remedy, cancer originates in epithelial structure. Again, as a medical student, and you are in final year, you are done with your physio and what do you understand with this statement? Cancer originating from epithelial structure. Meaning, this is a remedy which has an affinity for epithelial cells. Okay, fine. So from wherever the epithelial cells are originating, those structures, they might go into cancer. Okay, so where do you see epithelial cells? It can be seen in the skin. Fine. These are different types, again taken from Google. But what I want you to understand is, epithelial tissue or epithelium forms the outer covering of the skin and also lines the body cavity. It forms the lining of respiratory, digestive, reproductive and excretory tracts. They perform various functions such as absorption, protection, sensation and secretion. So what I want you to understand here is, you will be seeing, you know, the remedy that I am going to discuss today is the last remedy you saw on the CS stomach, CONDURANGO. So CONDURANGO is what we are going to discuss. So this is the remedy, a very small remedy, partially proved remedy. So CONDURANGO is what Dr. Clark says, it has an affinity for the epithelial tissues. Okay, so we will look further, and it was not introduced by homeopathy, or it was not introduced by homeopath. Before homeopathy, in the ancient times, they write in the past, the plant was considered as a medicine in treating CS stomach. Okay, so before homeopathy only, there was, there were people using it. And then one Dinsmore, he was the one who homeopathically proved it. Okay, and again, after a few years, Dr. Burnett, you would have seen a lot of his books in your library, a very great homeopath, contributed a lot to this particular science. So he again reproves it and he confirms that CONDURANGO is a beautiful remedy for cancerous affections. The bark is what we use here in our homeopathic preparation. So CONDURANGO is the remedy, that is what we are going to understand. And quickly, a rare remedy we have three simple objectives. At the end of the class, you final year should be in a position to describe the symptomatology of Condurango. This is one. And second very important thing is, as you are a final year student, we need to compare. So a lot of remedies will be coming up for CS stomach. Now when Condurango and when the other remedies is what we are going to understand. And the last very important thing is, where do we use Condurango clinically? Or what are the clinical utility or clinical indications of Condurango? Three small things. We are just giving you the symptomatology and then comparing, and then we are looking at the clinical indications. Hope the objectives are clear. Okay, we'll go in a very systematic way. First thing, we'll look at the cancerous part. As a final year student, this can be a theory question which can come up for 5 marks. And describe the cancerous affections of Condurango. Or they might ask you to compare Condurango with other remedies. Either this. Okay. So what I want you to remember is, we see cancer in Condurango. Where do we see cancer in Condurango? Mainly in the epithelial structure. For example, lips, for example, skin, or for example, the inner lining. The hollow structure, for example, stomach. Okay. You can also see it in the breast, or you can also see it on the nose. Nose, chin, lips, skin, stomach and breast. These are the areas where you see cancer in Condurango. Okay. So these are the areas, right? So now we look at the symptoms. I'll be starting with the stomach cancer first, and then we look at the breast, and these things will just club it together. So CS stomach. As a medicine student, what are the common symptoms of CS stomach? Huh? Okay, there is coffee ground vomiting, very good. Huh? Coffee ground vomiting, many times they can come to you with anorexia, bad burning, bad pain, fine, vomiting, and what your friend was trying to tell is vomiting which is coffee ground vomiting, pain, discomfort, okay. And the secondary effects, like for example emaciation, weakness, etc. So you have vomiting in Condurango. Okay. So what is the character of vomiting you have is again very important. Cancer of stomach, when there are severe pains and vomiting of coffee ground material. And this is a very common symptom of CS stomach. Vomiting of coffee ground material, very important. Okay. And second very important thing is the pain, the character of pain. In Condurango, in CS stomach, pain with constant burning and vomiting. See, this is very important. Food seems to stick behind the sternum. There is a sensation, there is a feeling as if the food is stuck behind the sternum. If indicated, reduces the pain in gastralgia accompanying cancer. Okay. So whatever gastric pains are coming, and what is the root cause for this gastric pain? When it is cancer. I was looking through many books yesterday, and many authors, they very strongly recommend Condurango for this particular condition. Fine. Pains because of CS stomach. It can reduce the pains. Okay. And what you also see is there are hard, knotty, large nodules in the pyloric region with complete loss of appetite. We were discussing this, because of which there can be emaciation and a cachectic look. What is this? Cancer, people with cancer, fine? They are not able to eat, they start losing flesh, they start losing muscle, they look very weak. Okay. So cachectic look, fine? And see, again, if you look at the ancient usage of Condurango, people, they used to use the juice of this, and it was told it will improve appetite. Okay. So from Dr. Borik's Materia Medica, what I got yesterday was stimulates the digestive function and thus improves the general health. Stimulates the digestive functions and thus improves the general health. So these are things related to CA stomach. CA stomach. So I was trying to tell you that it can also cause cancer of the lips. We saw that cancer of nose, cancer of eyelid, what we commonly call it as epithelioma. Okay, epithelioma is nothing but a growth, a tumor, benign, cancerous, which is coming from the epithelial structure. Okay, so Condurango has a special affinity for the epithelial cells, very important. Now, apart from CA stomach, apart from the epithelioma, I also told you that it is a very good remedy for CA breast. Other remedies for CA breast? Vitalaca, you have told about asterial remains, conium, good. When do you think of conium in CA breast? Induration, hardness. When do you think of bellis in CA breast? When do you think of belly spur in CA breast? After a blow to the breast, after an injury to the breast, if the breast tissue is turning cancerous, bellis and hypericum. Bellis and hypericum. Okay. So conium, asterius rubens, fine. Okay, phytolacca. We'll talk about other remedies a little later. We will look at the indications of Condurango in CA breast. Mainly the breast tissue is affected, as you saw there, and there are these lancinating pains. A better remedy, lancinating pains in CA breast is again asterius rubens, starfish. Okay, so lancinating pain, nipples are retracted, pain extends from tumor to whole breast. So the lady will be complaining that the pain from the tumor, it is extending to the whole breast. In asteria, pain can also come to the hand. Fine. In asteria, pain from the affected breast, it can go to the axilla or it can come to the affected hand. Okay. So axillary glands enlarged, hard tumor, skin purple in spots, wrinkled, ulcerated with fetid discharges. So the affected breast tumor can go into ulceration and then there can be offensive smell coming from it. Okay, so these are the indications you have, and the books also talk about Condurango. It can be thought of in ulcerative stage of cancer. So it is the next level, next stage, where the growth is going into ulceration. You can think of Condurango. Now, very important. Any vague idea if you have read Condurango or if you have come across Condurango, CA that is associated in Condurango with CA is the corner of the mouth will be cracked. The corner of the mouth will be cracked. Fine. Any other remedies you can recall? Corner of the mouth, angle of the mouth cracked. Okay, Mark. See, remedy as simple as aram, nitric acid, graphitis. There are a lot of remedies. But only remedy you have in your materia medica, painful cracks of the angle of the mouth. What is it? Painful cracks of the angle of the mouth is Condurango. Only remedy mentioned. Okay? So this is what I was just trying to tell you. See, indirectly you can also comment about another symptom from the knowledge of your anatomy. What is it? What is this area? What is this area? Mucco-cutaneous junction. Mucco-cutaneous junction, where the mucous membrane and skin is meeting. Fine. So what are those remedies? that we have in our materia medica which affects the mucocutaneous junction? At least one. You should be aware is nitric acid. Huh? Okay, so wherever, for example, the vaginal part, the anal part, wherever the mucous membrane and skin meets, there they will have issues, there they will have problems. Top remedy is nitric acid. You should also remember graphitis. Graphitis, mucocutaneous junction. Okay, graphitis and nitric acid. So here what you have to remember is painful, see this is very nicely mentioned, painful cracks in corner of mouth is the guiding symptom of this particular drug. So how do you differentiate other cancer remedies from Condurango is, Condurango will have painful cracks, not everywhere, painful cracks specifically in the mucocutaneous junction. This is very, very important. So before I take up the other part, we will quickly look at the cancer affections. So what was the cancerous affections that we saw in Condurango? First line, yeah, it affects the epithelial structure. In brackets we can proudly mention Dr. Clark. Okay, and after that what are we trying to look at? From the knowledge of anatomy we are looking at those structures which are coming from the epithelial tissue. So what did I tell you? It can affect the eyelid, it can affect the nose, it can affect the lips, it can affect the skin, or it can also affect the tubular hollow areas like stomach, or it can also affect breast. Okay. So these are the areas. See, you don't see in Condurango CA uterus. Okay. You don't see CA liver and other things mentioned. Predominantly stomach, predominantly breast and the other areas we saw. So what were the symptoms under stomach, CA stomach? There can be copular vomiting. We are talking of the pains. Huh? What is it? Yeah, food feels it is stuck behind the sternum. Good, then? Okay, the pyloric end also is knotty and it is hard. Okay, then loss of appetite, emaciation and that cachectic look, that weakness which comes because of cancer, that weak look, that emaciation that you see, cachectic look. Okay, then what else? We also saw there is a breast. What is the symptom you saw? From the tumor, the pains are spreading around the breast. Lancinating pains, okay, axillary glands enlarged, and it can be thought of even during ulcerative stage, and you have offensive discharge coming from the growth. Okay, so that was cancer. Now, other than cancer, what do you have in Condurango? See, there is something called a stricture of the esophagus. The esophagus is going into stricture. Okay, and there is burning pain, and again the same thing we saw, as if food seems stuck behind the sternum. Food feels stuck behind the sternum. That's one thing. And second thing, other than cancer, what we also have in Condurango is varicose ulcers, indolent ulcers of legs. Now what do you understand by indolent ulcer? Huh? Which are non-healing. Very good. Which are non-healing. I'll just share a small case. Because one of your friend was insisting that final year remedies or final year material we should have more of cases. I had a case of one of our colleagues' grandfather. Almost he's been with me for 1.5 years. He's taking treatment. I've tried n number of remedies, and I was a big failure in this particular case. Huge ulcer over the tibia, in that area, and over the heel. Lot of understanding, lot of analysis I did, and see, 1.5 years is a huge period, and I should have tried some 10 to 15 remedies. Unfortunately, nothing helped. And one fine day, it so happened, he started seeing maggots coming. You understand? Maggots coming. And He said, sir, the colleague of mine, she called and she said, sir, my grandfather is not in a good frame of mind. He's telling, he wants to end his life. Fine, it's not better, and he was terrified seeing maggots coming from the ulcer. And he said, he was thinking of suicide. He said, sir, I feel like going to Srirangapatna and jumping into the river. No? So how do you approach this case? I have given him sepia, I have given him Marsol, I have given him lot of other remedies. But what gave him results? Silicea, you name it. Carbonimalis, arsenic, constitution, specific, everything done. I was so fed up, even my assistants, they started contributing. Sir, why don't we try this? I said, fine. If that makes sense, okay. Their suggestions were also considered, and if we felt it made sense, we also prescribed. But unfortunately, nothing worked. And this is where he landed up. He said, let me end. Sir, you are also trying so much. Nothing is happening. Right? 1.5 years. I don't think you would have got a patient like me. I am troubling you so much. Okay, I thought of Aram. Oh, he's troubling me. Fine. Reproaching self, blah blah, Aram asks. I told you 1.5 years. Not whatever, and I am a material teacher, whatever remedies I know. I tried my best. Unfortunately, nothing helped. Then there is a rubric in your repertoire. Ulcers, maggots with. Okay. We entered through that. And what was he talking? He wanted to jump. He wanted to end. So we also took this rubric, suicidal thoughts. He didn't attempt. He didn't do that. But then he had those thoughts. So these two things we mixed, and a new remedy, a new totality, a new remedy came up. And that remedy was Merck. Merck. So after Merck, must be within 3 weeks, the entire ulcer is beautifully covered and it's all clear. Now what is it that I learned from this case? 1.5 years, wrong homeopathic medicines, wrong homeopath, and he did not improve. Okay? And then we changed the totality, and the right homeopathic remedy did wonders. Fine? Seriously, this going about on one part is absolutely closed. It's all clearly closed. And then there is another ulcer below. Now, what does Dr. Haring tell? About downwards. Fine? So, it's going according to Haring's law, it's clear, and then you have one more in the heel, which I am sure it will also close. It will also close. So, indolent ulcers. Better remedies. Say, I forgot to mention, I tried carbo-veg. That's the remedy. Very commonly used for indolent ulcers. Carbo-animalis. You open your repertoire and you name the remedy. Unfortunately, I have given all the remedies without results. Okay. So, varicose ulcers, indolent ulcers of the legs. Now, this you would have studied in another remedy. What is this situation you are seeing here? It increases the growth of granulation tissue and it hastens cicatrization. Now, what is cicatrization? Scar formation. Healing followed by scar formation. So, a better remedy we all know is calendula. Very good, calendula. So, in brackets you can also have calendula. So, you should also remember CONDURANGO has that capacity. So, what else you have in CONDURANGO is locomotor ataxia. Fissures about mucocutaneous outlet. This is something we already understood. This is something we already saw. There are fissures, there are cracks at the mucocutaneous junction, similar to what we see in nitric acid. Okay. So we look at few remedies for CS stomach, and we'll try to compare. I'll give you the symptom and you answer. Okay. So the first remedy for CS stomach that I will be comparing today is cancer of stomach, pain in spot in stomach with agony and depression preventing sleep. There is intense burning and thirst. Cali, what would you think of Cali? Spot, very good. It's not Cali, no issues. That's why I wanted to confuse you and I got this symptom. I'm happy I thought of Cali. Good, but it is not Cali. Cali bike, not all Calis. Cali bike will have pain in spots, very prominent. I want the remedy. Very good, oxalic acid. No problem, it's not oxalic acid. Okay, he's at least given you a clue. He's at least given you a clue. The remedy is acetic acid. Acetic acid. No problem, good, acetic acid. The second situation you have is arsenic amar. I've given you the remedy, give me the indication. Don't be happy. I have not done it by mistake. Oh, arsenic came, so sir will give you. No. Now give me the indications of arsenic. Very simple. Very good. There is burning. First thing is burning. There is thirst. There is intense restlessness. Burning pain better by hot application. CS stomach, vomiting of blood, coffee ground vomiting, all those things are common. Okay, arsenic amar, anything cold is thrown out and he generally likes taking warm food. Okay, how is it in bismuth? Bismuth. Fluids vomited, solids retained. Fluids vomited, solids retained. Bismuth. Okay, CS stomach. Vomits, fluids, solids retains. Okay, and then what is this? Cancer of stomach, especially the pyloric end. The remedy is carbonimalis. Only the pyloric end. Knowledge of your anatomy, pyloric end. And then we have spasmodic pain extending from pit of stomach into back and shoulders. There is also swelling in pylorus. Swelling in pylorus. This is conium. This is conium. Okay. See, another remedy is hydras test. How is it in hydras test? Okay, very good. There are stingy discharges like calibite, but related to stomach, vomiting of stingy mucus possible. Okay. See, hydras test is something very interesting. It is indicated in cancer before ulcer sets in. Please remember this. Once the ulcerations are started, hydras test will not work. That is what stalwarts have observed and they have mentioned in their materia medica. Maybe it is not that deep a remedy that it can also cure ulcers. Once ulcers are there, hydras test has no role. This is what source book gives us. Vomiting, everything except water. Fine. Pain in pit of stomach, there is emaciation. Cancer before ulcer sets in. That last statement is very important and I want you to remember that. Burning, corroding pain, great emaciation. This thing it's very interesting. Gastric mucosa feels raw with sensation of food remained for a long time. Vomiting of chocolate colored material. This is a remedy that we will not think of. We think of this remedy neuralgias in skin. Very good. What is it? Neuralgias and skin. I don't know if I got the remedy right there. If I had the remedy, meserium. The remedy is meserium. Okay. They are all given 3 marks in your repertoire, so I thought I should give you a small information about these remedies. You know phosphorus, similar to arsenic, bad burning, but better by cold. There is a lot of blood, it's a hemorrhagic remedy, lot of vomiting of blood. Hematemesis, fine. Phosphorus. Okay, I have left it blank. Cancer of stomach and cecum, mainly pyloric end, pain increases when food passes through the pyloric outlet. When he is eating, he is not having any problem. When the food is passing through the pyloric end, when it is getting emptied into the duodenum, he will have severe pain. And which is giving us a clue that the pathology is more in the pyloric end. And this remedy is dedicated to my friend, and what I was trying to tell you is Ornithogalum umbellata. Ornithogalum umbellata. Okay. In CS stomach, when there is persistent vomiting, non-stop vomiting, they are vomiting. Single remedy you will have to remember is cadmium sulfur. Cadmium sulfur. Vomiting in cancer, continuous is what is it? Cadmium sulfur. And if a person is only vomiting blood, I hope you understand the seriousness. So, any wild guess which is this remedy? It is not all those of your hemorrhagic remedies. Somebody said some remedy there. Very good, beautiful, good. Calendula, good. Keep it up. To be very honest, I realized only today that calendula is the remedy. This is the advantage of a teacher. When I start preparing for your classes, in the bargain I also learn. And calendula, you have one more indication. When else do you think of calendula in cancer? Huh? Okay, I mean it can stop the offensive odor, agreed? Palliate the condition, and one more indication you have. Huh? After surgery, okay, fine. Huh? As a prophylactic, fine, okay. And absolutely right, it can, what is it? Like, say calendula mother tincture, you all know. I mean, it's been used since ages for the injury, okay. So calendula for blood, vomiting of blood, okay. Now, so this was about CONDURANGO. One last thing which will, sum up everything. Clinically, tomorrow, where do you think of, or when do you think of CONDURANGO? In which conditions can you think of CONDURANGO? This is the activity. This will tell us how much of it you have understood. So you can start contributing. What are the conditions where one can think of CONDURANGO? Huh? Okay, cancer in ulcerative stage. Stomatitis, yes. Fissure at the angle of the mouth, but it should be associated with usually cancer of stomach, and they are very, very painful. Okay, anything else? Gastritis, gastric ulcers. Gastritis, gastric ulcers, and it can also stimulate digestion. Huh? Fissures, okay. Huh? Stricture of esophagus, very good. Very good. Locomotor attacks there, good, correct. Then, okay, CA breast, gastralgia, okay. For cancer pains. Then, okay, varices, indolent ulcer, varicose ulcers. A better remedy for varicose ulcer. I mean, I should not tell like this, but then there are some remedies which are more specific, and one remedy can be fluoric acid. Very important remedy for varicose ulcers. Okay. Then anything else? See, fluoric acid. What is the key word for fluoric acid? What was that? Very good. Buoyancy. Now, what do you mean by buoyancy? Good. Appreciate it. See, why I feel nice is these words, buoyancy, buoyancy and all, we read very recently. I'm not jealous that when you are in final year. 4 years into homeopathy, and 4 years back I knew buoyancy. I'm not comparing that, but I feel very nice because I thought I'll just, you'll not know and I can take some bow here. But anyway, she spoiled me everything and she said, sir, buoyancy. Now, what is buoyancy? Very good, thank you. Buoyancy. What is buoyancy? Okay. See, See, I mean anything in folic acid is very superficial. Very superficial. I had a patient recently. I had prescribed some other remedy. And I was just asking him, how is your job? Sir, I left job. It was a casual talk. I was just asking him, boss, how is your work going on? Sir, last week I resigned. What happened? Why did you resign? No, sir, some issues came up. And my service is, in last 30 years of my service, I have changed 30-35 jobs. Okay, 30-35 jobs. So what should be the next question? Boss, why do you change so often? We are still stuck with one job. But why do you keep changing it so often? Sir, I start from zero. The company, his condition is the company should be zero. And it takes up to top. And once he takes up there, he feels bored. He feels bored. He cannot sit in that AC cabin, sign papers, enjoy life. No, he gets bored. And he will resign. He will go to another job. Again, it should be sinking. That he will lift it up to the highest position and he feels bored. My job is done. I have no role to play here. So this way he keeps changing. And this is what I learned from Vijaykrishna sir. When people do not have any kind of a bonding, any kind of an attachment. So then I started asking all the questions like you people do. What you read in Dubai, whatever you start asking. Direct questions, which we generally don't do, but then it was a very nice scenario I got. Then whatever Vijaykrishna sir had told me about folic acid, I started answering. And I started questioning. And luckily, everything, I don't know what it was. He was just doctor, yes, that is how this is how that is. And one more very important thing that you have in folic acid is their nail grow very frequently. Their nail grow very fast. Their hair grow very fast. Fine. And what is folic acid all about? Yeah, see what we know is sexuality. Unfortunately,